Hello, 211 Facebook. I apologize. We are live. How is everybody today? Welcome, welcome. I am here with a special guest. I'm very excited.
Hello.
For you guys to get to know her. This is Miss Grace Garrett. She is 211's mental health navigator. Now, if you're thinking, okay, I know about mental health, I know now navigation, how do those things tie into 211 and what you guys are doing? Well, there's a lot of background to kind of how Grace came about. But first, let's get to know this amazing lady. Grace, what's your first interaction with 211? How did you hear about the agency?
Well, I started out as a volunteer counselor. I heard about it just going about my everyday life at FSU. I'm a psychology major there. There was a flyer posted in the psych department, and I went to the first informational session and loved it, and I became a volunteer.
Oh, we love our volunteers. Matt, props to you. And how long ago was that? About 2 years?
That was in the summer of 2016.
Okay. So you volunteered at first. Now that's volunteering on the phone lines as a counselor. So you were answering these community calls.
Yes.
You know the people or the type of people that are calling in here, and you're able to help them. Awesome.
Yeah.
We love that. So then from there, you took on another role.
I became a part-time counselor in the summer of 2017, about a year later.
Nice.
So I worked part-time with our callers on the phone, and then I enrolled in this position, got this position in January.
So you know about 211 and everything that it encompasses and all the different agencies and organizations that we reach and refer to us, and you just know this gamut.
Yeah.
Yeah.
Guess so.
She knows it. Hi, guys. If you're watching, this is 211 Big Ben, your Regions Go-To Crisis Hotline, and I'm here with our new mental health navigator. And we're going to talk to you guys about how that came about and how you can utilize those services, or friends or family that you know can utilize those services. So Grace has been with 211 now for a little while. Thanks for the hearts. Comment below if you know her. She is so cool. Tell her hello and welcome to this new position. Although she's been with 211 for a little while, we want to show some love. So you were a volunteer before.
Yes.
And then a counselor.
Yes.
And then let's back up to the United Way, which we are affiliated with, and FSU College of Medicine. What is the connection with those two?
So the United Way gave us a contract to develop this mental health navigation program in collaboration with the FSU College of Medicine.
Okay.
There's been a conversation about the need to develop some sort of resource database to allow our callers to know about the resources that are out there and the information that is out there for mental health.
Very cool. And what FSU already has a database, from what I understand?
Yes, they have an FSU mental health resource database that actually started out as a maternal mental health database.
Interesting. Yeah, FSU, they do a lot of stuff with all this, and the College of Medicine is so great and such an awesome resource for us. And so many students come from there to volunteer with 211 as well. So they started out as a maternal database, maternal mental health database.
Yes, and the lab that created the database under Dr. Heather Flynn at the College of Medicine, they're the maternal mental health lab, so that's their focus.
Okay.
But through this conversation with United Way about this need to develop a more comprehensive mental health database, they've slowly been adding in more comprehensive mental health referrals, and now we have what we have today, a database of about 200 mental health resources in the Big Bend community.
That's just in the Big Bend. That's about 8 counties.
Yep.
So FSU College of Medicine, their database started out, Grace is saying, as a maternal database for mental health, and it's evolved after speaking with United Way into this more general, let's reach every person, mental health related, because as we have seen in the news lately, and I think specifically the past couple of years, it's really becoming a big focus. And I think a lot of our part here at 211 and different organizations within our community is breaking down that stigma. Hey guys.
Hello.
What is #CryptTheVote? Mental health info. Way to go. Oh, thank you. We will check that out. So breaking the stigma is huge on just getting out and talking about it. Me and Grace were mentioning earlier about just speaking about it and breaking down that it's okay to get information on those things.
Exactly.
Because it's huge.
Exactly. And not all our callers will accept a referral for those resources, but just the fact that we're encouraging the conversation on mental health at all and just asking about it, checking on them, making sure if they need anything related to that.
Right.
We're breaking down that stigma and improving the conversation on mental health.
So United Way and FSU came together and they said, we need to reach a bigger audience. So to them, their logical choice was 211.
Mm-hmm. The logical choice was 211 Big
And
Ben.
why is that?
We've already been getting those kinds of calls ever since we've been established, and we have the resource information database already in place. We have about 50 counselors that are around the clock here at this 24/7 agency, so we are the logical choice to be able to take these kinds of calls.
Right. And we're so grateful to you guys for thinking of 211 and making that choice. Because we are here to help in any possible way that we can when it comes to mental health. So in that decision to bring on 211, they house the mental health navigator here. In comes Grace Garrett. So Grace, how long, this just launched, your position.
Yes, it launched, well, I started my position January 2nd, but the program itself launched March 1st, just a few days ago.
Yay!
Yeah, so we're officially taking calls. Other counselors are trained on how to provide mental health navigation to you all.
Perfect. So somebody's out there thinking, well, I've had this question, or I have a friend or a family member and I have a question about them. What do they do? Let's talk it through. What are the steps that they would take to get in touch?
If that family or friend called us, well, they can just give us a call, and if they're concerned about a family member, a friend who may have a mental health concern, we're able to provide them with any referrals that they might feel that is necessary for that person, any information that they might want to know regarding mental health. And any of our counselors can take these calls, but then that counselor will ask you if you would like, or if they would like, a follow-up from our mental health navigator, which is me, and I'll follow up in about 2 weeks and just check on them, provide support, advocacy, and care coordination, see if those referrals worked out for them. Do they need any more referrals?
I love that. So you just dial 211 is what I'm hearing.
Just dial 211.
The next steps will be taken for you as far as getting those resources and referrals. Now, is it your experience that you've heard, well, I don't really need that, or I don't know that I want to explore those options? Have you had that feedback?
Yeah, I've had that feedback.
What would you say to that person listening right now?
Well, if they told me that they don't feel that they have the time, we might explore it a little bit more, because a lot of people do feel like even if they have a legitimate mental health need, they have sort of a preference for managing it themselves. They might feel like they don't have the time, because so many of these callers are also experiencing other stressors like finances and their kids, family members, and they just might feel like they don't have the time. And so I might explore them a little bit more and try to tell them the importance of seeking that care. But if they don't want to, that's okay. And they know about this program. We're here. You can call us back 24/7. So when you are ready, we're here for you.
Which it is very common that callers that do reach out may call and hang up, or call and hang up a couple of times, and they're just testing the water, seeing if it's right for them.
That's okay.
And
but we're here when you're ready.
Yeah, I love that. Awesome. Do you have, let's break it down to the Big Bend region, and I guess, I don't know if you have any national numbers for us, but can you touch on some of the statistics with mental health, maybe some people who don't utilize those services? What are some of those statistics?
Yeah, so untreated mental illness is actually the leading cause of disability in the United States for people between 15 and 44 years of age. And in the Big Bend community in particular, about 20% of people experience mental health concerns, which is a very large number. And I like to tell those numbers to our callers so that they know that it's not just them. A lot of other people are experiencing this too. And it kind of normalizes it and makes it okay.
Right.
For them to seek out that help.
Absolutely. We have Marisa, I think that's how you're saying it. You're an old 211 supervisor. Yay! Thank you for listening and being a part of the 211 family. And I'm on a plaque still, I think. We are going to have to look for that. If you know what plaque, let us know. And just also asking, what about PTSD issues, which is an awesome question, and I think we should do a post about that, and because that has its own huge thing, I'm sure. But are we getting a lot of calls related to PTSD? Have you experienced some of those, or know
I've
any of
gotten a
those
few
numbers?
calls of people seeking EDMR therapy in particular, which is a type of treatment for people with PTSD. And we have a lot of referrals or a lot of resources for that in our database. Any Central Florida information? Well, I'm not sure if
anybody can
in
dial.
Central Florida have a mental health navigation program in particular, but anybody can dial our 10-digit number and at least get information, even if we don't have resources for Central Florida.
Well, anybody can dial 211 within their area, and that the zip code that they're in will route them to the nearest 211, and they can get you the referrals and information closest to you or the person in that area. Like, we've had a mom who was concerned about her child here going to Florida State that had suicidal thoughts before, and she was able to get in touch with the 211 here to get him services here instead of down south where they were at. So wherever you're at, it'll get you routed to those that information center for sure. Great questions. Thank you. Is there, so the goals, as we were talking about, well, what are the goals of this mental health navigator position? Clearly, we want to get words out there and people reaching out and feeling comfortable reaching out and having those resources available to them. What are some other goals that you want to touch on or let people know that this is really important?
Well, we're definitely working to improve the overall utilization of these resources by educating people, giving them this information and giving them the resources. We're working to improve the overall conversation on mental health and reducing the stigma, and not only giving them these information referrals, but being able to provide that follow-up care coordination as well, because that is so important. After they get the referral, what happens? We want to know, are you able to get in contact with these providers? Do you need any more? Because that first step of seeking treatment is usually always the hardest part of getting treatment. It's just that first step, just finding somebody. So that's what we're working for, to help you find somebody.
Such a good point to make. That first step is just finding somebody, and then it's kind of a snowball effect after that?
Yeah, just a snowball effect after that. It can be hard to find a provider who is currently accepting clients and who fits your exact mental health needs, takes your insurance, et cetera, et cetera. But luckily with our database, we're able to filter through your insurance, the mental health need, and we have so many different providers. We can give you as many as you need until you find somebody, and we're able to provide that follow-up to make sure that you were able to connect with them, and if not, continue to help.
Wonderful. And with the United Way and the FSU College of Medicine involved within this, we're kind of saying, okay, how are we going to get this word out? How are we going to spread the news that this is available? And while we can come on here and do live videos and give you all the information on our end, we know they're doing the same as well and advocating. Can you tell us some other steps that are being taken?
Well, we're trying to provide this database to primary care providers, since that integration of mental health into primary care is so important, because most times people see their primary care provider first when they have any concerns, even mental health concerns. Primary care is usually the first line of defense. So we're trying to make sure that these primary care providers have our database and know how to use it, and if not, they have our number too and are able to give that out to their patients.
Oh, that's great. So if you are a primary care physician, or you know of one, or you visit yours, you can mention this mental health navigator to them, and we'll be more than happy to get them the information that they need, or reach out to us or the United Way. Is that right?
Yep. Mental health navigation program. Just let them know. Let your patients know.
Yeah. So again, we just really want to thank the United Way and FSU College of Medicine for thinking about 211. We are so honored to have this out there in the community, and we want to say thank you to Grace for taking this on. It's such a beautiful program that we are excited to launch. Is there any lasting thoughts that you want people to know about this?
Just call 211 and we're here for you 24/7. And I'm super excited about having this position. I've already been following up with callers, and I'm looking forward to continuing to do that.
Perfect.
I think it's so important. Long awaited.
Yes.
Yeah.
Long awaited, because this has been in the works now for over about 2 years. I think they've been trying to get it up and rolling, and it's here and it's launched, and we're so excited. So utilize it. It's here and it's free.
It's free.
Like, it's free. So give us a call, give us a shout if you think I can't afford that. Grace will figure something out. We'll get you in touch with the information and referrals to get you the help or the assistance that you need, because mental health is huge. It's really important. Just like physical health is, it's the same thing. So get out there, call us, spread the word, and we appreciate you guys. And you know what? Help starts here at 211. With help comes hope. Thanks, guys.
Thank you.